Kari Severson, and I'm the founder and CEO of Walkway. Today I'm going to give you a little bit of background on what Walkway is, some of the IoT components, and then I would love to get your guys' ideas on how we can take it to the next level. So just a quick introduction. Oops, sorry, Patrick. Where am I moving from?
It's not going to show up on the screen.
Here, I guess I'll.
Do you want to be
this? Yeah, I'll be your helper.
Perfect. Thanks for bearing with us.
Yeah.
All right, perfect. So if you think about today's technology-driven world, it's actually had a fairly detrimental impact on our health. If you think about the proliferation of technology, we're all glued to our smartphones, to our virtual networks, and as a result, we've become pretty sedentary. We roll out of our sleep number beds, we jump into our souped-up vehicles, fully automated, of course, sit down at our telehealth-enabled work sites, maybe come back to our lazy boys with our plasma screen TVs, and then we repeat it all over again. So with this type of a lifestyle, I decided to found Walkway to address the toll that technology has taken on health and really activate our lifestyles. The solution is a novel take on an existing product. You guys have probably already all seen treadmill desks before. They arrived on the scene in 2007. You can walk and work and get things done. What Walkway has done to the treadmill desk solution is actually connected the hardware to a new software solution and enabled us to bring in content to monetize the solution altogether. The result, active workstations that drive health and productivity. Now we're going to go to a quick video here. Walkway has brought these treadmill desks that are actually sponsored by corporate partners, and we brought them into public spaces. You might have seen some of the footage. We just launched at the Minneapolis-St. Paul International Airport, and we have 3 Walkway workstations in the C concourse and in the F concourse. These Walkway workstations are actually free for passengers to use, so before their flights, after they go through security, instead of plopping down at the gate, they're able to get some steps in, to charge their devices, and to access the internet before their flight. So we're really excited about it. We're going to show you a quick video so you can see kind of footage of how we're
arriving this month. The all-new Fiat
500
Reserve yours now.
Quick commercial.
Yeah, quick commercial break for everyone.
See us at fiatminneapolis.com.
All right, here's what it's all about. I'm going to stop talking.
Driving discover Fiat of Minneapolis.
They just want you to sit and drive.
500L for just $2.50 a month. Arriving this month. The all-new Fiat.
We'll give it one more shot, otherwise
Reserve yours
it's
now. Visit us in Bloomington or St. Louis Park, or see us at fiatminneapolis.com.
That's right. Huh. All right, well, technology is not going to be our friend tonight, so let's just skip that. Let's go ahead and skip it. We'll go back to the presentation. What you will see is basically the Walkway workstations promote our sponsors in 3 capacities. The first is we actually have their brand on the workstation itself. So they're getting physical signage. People are really surprised to see treadmill desks in public spaces. They're doing double takes. We're getting great brand impressions for our advertising sponsors. Secondly, we have a digital experience where people actually have to watch an advertisement. It's just a 30-second sponsored health promotion message to walk for free. And finally, we feature our sponsors on our social media and in our PR materials. So what you missed in that video is just kind of a rundown visually of how that all comes together. Now to get to the heart of this, how this all works. We have actually partnered with Microsoft in their BizSpark program as a small business, and we're using some of their expertise and their platforms to really drive our technology agenda. So we've actually deployed the Walkway experience through a Windows Store app, and we're leveraging Azure for content management storage in their cloud-based app, as well as our user tracking. Next up, we're going to be having, we'll be building a mobile app and a web app around that as well. Now you're probably wondering, this doesn't really feel like an IoT solution, so what are the linkages? The first is safety. So the number one barrier, you've probably seen treadmill desks in corporate settings and private homes, you haven't seen them in public spaces. The barrier to that is liability. People are worried that you're going to get hurt using them. What we've designed from an IoT perspective is actually an IntelliStep system. So if the treadmill doesn't detect a foot strike, for 15 seconds it will actually shut off. We also have enabled this such that the whole unit will not power up until you sign a liability agreement. Secondly, I mean, it's going 2 miles an hour. It's not that dangerous, I promise. Secondly, from a sponsorship perspective, we actually use our Azure cloud storage to deploy site-specific sponsor content. So we can send, a Target advertisement to the Minneapolis airport and a Best Buy advertisement, to children's hospitals and clinics. So it's automatically distributed to the sites and the locations we want to get to. Secondly, we're also able to do user tracking. So after you walk on a Walkway workstation, you're going to get an email report of how far you went, how long you used it, how many calories you burned, and that's automatically sent to your smartphone. It's a nice informatic for the user as well as for our sponsors. They love the analytics, they love the impression and all the data that they're getting from our solution. And finally, from a service perspective, we've actually leveraged Intune to develop a system where we're able to ping the workstations, make sure that there's connectivity. If we lose connectivity, we actually get an alert and a notification, and we're able to do a remote reboot. So that's where we're at today from an IoT perspective. If we flip forward, today we're in the Minneapolis airport, we're in several co-working sites and corporate locations, but we're looking to expand elsewhere. And this is where I truly welcome the expertise of anyone in this room. Technology is not my home base. I'm stepping into it and trying to learn it. But if you guys have ideas on how we can get deeper IoT integration and perhaps even integrate with some of these sites, either from a communication standpoint or trying to pull in health and wellness messaging and activate these spaces in new and unique ways, I'd really welcome any ideas that you have. Yeah.
Have you considered having a chargeable desk? I'm working on something with Cambria on this right now, but something where you put your device on and it just starts charging the device.
So our solution kind of works like that. The question was, have you ever thought about setting something on the desk and it charges the device?
Yeah.
Automatically. The way this works today is when you walk, it charges the device.
Oh.
So it's kind of like a hamster wheel of sorts. And that's kind of how the solution is today. So it's not by setting it on the desktop, but it's by taking moves. It's just programming that detects that the belt is in motion and it activates the device charger. So to be honest, we didn't want people at the airport to grab their Big Mac, come over to the desktop, eat their burger on it, and take our device charging when someone else could be walking and charging. So it's really to keep people in check and responsible and healthy. So, yeah.
What's the unique part about, so what stops anybody else to basically just do exactly what you did?
So great question. We are really building off an existing product, and I think our unique value add on this is bringing together the hardware, the software, and the content, and going to market before people.
So
this is a patented design, so we do have some teeth there. Nobody's actually been able to line up the advertising sponsors and then get the technology to make it all come together. But somebody certainly could duplicate this, aside from the patent.
I would have.
Oh, sorry, go ahead.
I would have lots of follow-up questions, but not like.
Sure, I'll give you my card. I'd love to talk.
One of the things that I've seen was very successful is when you gamify things. So if you try to get multiple people compete against each other and the winner wins something from your sponsor, maybe a free coffee from Starbucks.
Yes, that's actually a fantastic idea. I love the Starbucks tie-in. Right now we don't have any gamification built in, but our goal would be things like step challenges. So from kiosk to kiosk, like who can rack up the most steps. When you check in, maybe if you get 10,000 steps in a month, you get some Walkway gear. We have a lot of ideas around the gamification that we think are fun, and that's probably the next iteration is to explore that space. I love it. I guess, and final slide, Patrick. just 3 key takeaways. We'll keep it short, sweet, and get to announcements for you guys today. But if I could offer any advice just in the startup space, in the health and wellness space, and in the IoT space, 3 takeaways for you. First of all, health. IoT is all about automation and making things sleek and simple. If there are ways you can do that in a capacity that's not detrimental to your health, I would ultimately encourage all of you to explore that. And I think there's actually a lot of ways where you can make consumers more aware of their health in the process and use IoT as a platform to do that. So I've got to put that pitch out there first and foremost. Secondly, experience. You guys would be shocked if you saw the first version of our user experience compared to what that UI looks like today. We really dumbed things down and kept it simple. So I'd recommend from a user experience perspective as well as just as a startup getting going. We'd love to build out a full gamification suite, but we wanted to start simple and start small, get some momentum under our belt, and then build from there. And finally, the financial side of things. So I think it's really easy to get caught up and over-engineer and want to develop the perfect solution. How Walkway's been really successful is by taking very small steps. Putting something out in the wild and piloting it, we learned so much from that. We probably should have waited another 4 or 5 months before we released our first prototype. But by taking that risk and getting it out there, we learned really, really fast. And we quickly got to a sustainable revenue model, which has allowed us to continue to develop and move down that path. So those would be my recommendations. I've got a jet, but I will absolutely leave business cards. And like I said, I would welcome any and all questions right now and then feedback from you guys to continue the conversation.
One quick idea. If you could put this, say, in the Department of Motor Vehicles office, somewhere where people are sitting around waiting.
Yeah.
Or in court where people got anxiety, if you can't get up and pace without looking like a weirdo. On the other hand, if you could go and spend, I'm taking 20 and they're getting to 8, I need to get to 80 or whatever, and you could sit there and walk and pace without looking like a weirdo.
The anxiety thing is interesting. Hospitals are excited about this because they feel that people are nervously pacing throughout their waiting rooms.
Right.
And so that's why we're excited about the hospital space. On the DMV front, we actually had interest from car dealerships. While people are frustrated and their cars are getting serviced, we put these in their rooms, and you can advertise your next brake repair special you've got going on, or oil change deal, or new vehicle you want to sell. So we think there's some interesting tie-in. Yeah.
When people are walking on this thing, is that considered, or could it be considered personal health information regulated by HIPAA laws in any way, shape, or form? And can you explain a little bit about that?
Yeah. So from a healthcare perspective, there's obviously a lot more regulation around personal health information, or PHI. This, in our liability waiver, you actually sign off on that right when you enter your information. We're not asking for anything personal beyond your first name, so there's really not a way to link it back. Your first name and your email address, but there's not a unique identifier where we could tie it back and identify an individual. And the nature of the data we're collecting is strictly steps. If you want, you can enter your weight, but that's optional, and then you can get a caloric burn. But we haven't been sidetracked by PHI because of our liability waiver, and because of the nature of the information we're collecting.
So it's an opt-in?
It's an opt-in. Yeah, that would be a much more succinct way of saying that.
So likely the larger companies have extensive healthcare incentive programs, right? And I'm sure you're aware of that. Why I just really see fitting in to that. Yeah.
We have, we're really excited about the corporate space. That's actually my background. I was at United Health Group, and I spent a lot of time in our wellness and prevention space, and I saw a lot of wellness programs fall flat on their face because people don't want to engage in them, they're telephonic, they're clunky. We think that this is a really simple solution that can make a big difference, and we like the tie-ins. It's not only a wellness platform, but it's also a communication tool. It's also a employee recruitment and retention tool. If you think about these being in the front lobbies of employer work sites, it looks really good if you're coming in for an interview and you see that an employer is invested in your health and wellness in this capacity. And I think it's also a lifestyle change. We're truly changing the way people are working. instead of sitting in your chair, the average American will sit there for 8 hours a day. You're actually going to get up and move and walk, and we think that that's a more clear value proposition to an employee than calling a 1-800 number to manage their diabetes.
Yeah, it's a quick hit. So how do we, so you'll leave your cards. Are you
Yes.
in any corporate settings right now?
Yes, we're in a couple small businesses, and we're looking, I can't reveal the names, but we're going to
Yeah.
be going into some larger employers this summer. So if any of you guys are interested in having these at your corporate work sites, please let me know. We can set you up. It's kind of fun. We actually do branding on the desk itself. We can play, there's a 30-second clip that rolls before you walk. So if there's an upcoming health and wellness challenge or open enrollment period or maybe an employee giving campaign, we can advertise those things and communicate it to the employee population. Switch out that content quarterly. It's just a nice solution.
Captive audience, okay.
Yes. We also offer treadmill desks for sale, so we have them in public spaces and consumers can try it before they buy it. They start at $1,000, so it's one of those purchases where oftentimes you do want to try before you buy. So that's our final channel.
Have you thought about turning it to some sort of medical device for obese patients? Like a
Yeah.
home use environment? Because I can see like 2 miles, that'd be perfect for
Yes.
patients with obesity.
Yep. Two populations. We think severely obese populations as well as elderly populations that can't do a significant amount of weight-bearing activity or high-impact activity.
Right.
We think that they're great for that. We haven't done any remote patient monitoring or anything along those lines yet, but obviously a lack of physical activity is directly linked to hypertension, diabetes, heart disease, all those good things. So we're trying to take a crack at reducing MedX in that capacity.
That'll be a great effort because I can see a lot of population and kind of some sort of underrated,
Yes.
with deaths for specific populations with the disease.
Yep, we definitely see the value and the tie-in there probably more than anywhere else.
Right.
Great.
Well,
Thanks, guys.
Kari,
Appreciate it.
Thank you very much.